Okay, welcome everybody. We're going to get started right on time. Very glad that so many parents and caregivers and educators and healthcare providers and others could join us this evening for this webinar. I'm glad to welcome you. My name is Matt Beal, and I'm a child and adolescent and family psychiatrist. I am the chief of child psychiatry at the Georgetown University Medical Center in Washington, D.C., and I'm also the chief medical officer of Fort Health, which is a telemental health company that is supporting mental health care that's evidence-based and high quality for children and adolescents, currently delivering care in New York and New Jersey. And Fort Health is co-sponsoring this webinar series with the Child Mind Institute out of New York City. This webinar is part of a series of roundtable discussions with clinical experts about topics that affect young people's mental health, which is very much on all of our minds. Each month at these webinars, we try to discuss what is good clinical evidence about important topics. We try to separate fact from fiction and show you as parents and educators and adults in young people's lives, practical strategies that you can use to help the children in your life. This month, we're going to be talking about one of the most important and really most neglected factors in human health, and that is sleep. Sleep influences nearly every aspect of our health. For example, the cardiovascular system is very, very sensitive to changes in sleep, but the effects of inadequate sleep are perhaps most acutely felt in the brain and in the rest of the nervous system. Our attention span, our memory, our critical thinking skills, our abilities to regulate our mood, our social skills, and our coping skills, our ability to cope with things that are difficult or challenging. These are all brain-based functions that are highly sensitive to changes in sleep. In my clinical experience as a child and adolescent and family psychiatrist, I very commonly see children and adolescents who are experiencing symptoms such as depression, anxiety, attention problems, behavior outbursts, learning difficulties at school. And I discover that sleep problems are often at the root of these difficulties. The American Academy of Sleep Medicine recommends that kids ages 6 to 12 should average about 9 to 12 hours of sleep per night. Teenagers from 13 to 18-year-olds should aim to get 8 to 10 hours per night. But as anyone who knows or takes care of young people is aware, the majority of kids in the United States and around the world do not meet those sleep standards. And oftentimes as adolescents get older and move later into high school and towards the end of adolescence, sleep patterns oftentimes worsen. There's data to suggest that 6 out of 10 middle school students and 7 out of 10 high school students do not get enough sleep to be healthy. And in fact, by the senior year of high school, it's very few students in most cases, in most studies, that are getting adequate sleep according to recommendations. This is not a new problem. 10 years ago, the American Academy of Pediatrics called the problem of tired teenagers, of exhausted teenagers, a public health epidemic, but it's getting worse for a lot of factors that we'll be talking about tonight. And the percentage of kids who get enough sleep dropped by another 10% after that report from the AAP came out in 2014 for the 5 years that followed. To help understand why this is happening and what we as parents and caregivers and educators and clinicians can do to help people get more healthy approaches to their sleep, develop healthier sleep habits and sleep hygiene, we've gathered here tonight a panel of sleep researchers, mental health professionals, and behavior experts to talk about their perspectives and their experiences and to think with you about strategies to make improvements in the kids' lives that you're taking care of. So I'm going to ask each of our panelists to introduce yourself and say a little about your work and your perspective on sleep, the work that you've done, and what brings you to this conversation tonight. So how about if we start with Jillian?
Hi, I'm Jillian D Tiberius. I am the clinical director for Graham Behavior Services. I am a board certified behavior analyst, BCBA, since 2013, and I've worked in bunch of different places, public, private schools, private companies. I'm currently at a private company now, and I received training in the area of sleep from FTF Consulting and am a certified sleep coach. I presented on the topic a number of times, and I've had multiple clients now who needed sleep consultation, who have autism and ones who don't. Typically, I can work with typically developing children or adults as well.
Thanks so much, Jillian. Glad you're with us. And I think one of the great things about this panel is we've got experts who've got experience working with kids, both neurotypical kids, neurodiverse kids, kids who have a history of medical problems, kids who have other developmental challenges, and also kids who may not have any of those difficulties but still struggle with sleep. Catherine, can I ask you to go next?
Yeah, hi. Thanks for having me. I'm Dr. Catherine Wesley. I'm an assistant professor of pediatrics and psychiatry at the University of Colorado School of Medicine. And I'm also a pediatric psychologist who specializes in behavioral sleep medicine at Children's Hospital of Colorado. So sleep is my clinical day-to-day, all that I do, what I love, and being able to help kids and their families get better sleep and see the benefits of that is really my passion. So I am thrilled to be here talking about this topic and hoping to help lots of you improve sleep for kids.
Fantastic. Welcome. Thanks for being here. And Valerie?
Hi, I'm Dr. Valerie Crabtree. I am a pediatric psychologist and oversee the psychosocial services at St. Jude Children's Research Hospital in Memphis. I'm a diplomate in behavioral sleep medicine and have been working with kids with sleep problems for over 20 years. I have in the past worked in a sleep clinic working with kids who are neurotypical and had neurodevelopmental disorders, and now focus my practice and my research on children and adolescents with cancer and the way that impacts sleep and daytime fatigue.
Fantastic. Really glad you're here as well. And I hope you all will forgive me for using first names. Please call me Matt too. Just hope to have a friendly and informal conversation. So thank you. We've got a lot of great expertise and pedigrees here in this group. And finally, Rachel.
Hi, so I'm Dr. Rachel Tenenbaum. I'm a licensed psychologist and I'm a clinical supervisor at Fort Health. So I've worked in a variety of different settings with kids and adolescents and their families. So children's hospitals, outpatient settings, inpatient psychiatric settings, and across all of them, sleep always comes up. So sleep's been a huge issue that I've helped a lot of families and children and adolescents work with. So I'm excited to be here to talk about that tonight as well.
Thanks, Rachel. Terrific. So let's just jump right in. I'm going to frame some questions and we'll get to hear from each of you. And I think we're going to have a really terrific discussion here. Valerie, let's start with you. I'd love for you to just give us a bit more, sort of flesh out some of the introduction that I started with. Tell us more about why sleep is so important for children and adolescents, and particularly perhaps highlighting the links between sleep and physical health.
Yeah, so I think you did an excellent job in the introduction highlighting how critical sleep is to physical and mental health and cognitive performance in children and in adults. And I think that sleep really is the third pillar of health, along with adequate nutrition and adequate physical activity. We know that sleep is crucial to immune function. So when humans are not getting sufficient sleep, we're far more likely to get sick. It takes us longer to recover. It's essential to tissue repair. So following any type of injury or surgery, it's really essential to get adequate sleep. We also know that because sleep affects cognition, it also impacts safety. So children and adolescents who are not getting enough sleep or have disrupted sleep are far more likely to have accidents, to have sports-related injuries. Our teenagers who are new drivers and already at increased risk for accidents are far more likely to have motor vehicle accidents if they're not getting adequate sleep. And certainly because it is, sleep is so essential for cardiovascular functioning, for insulin regulation, we know that over the long term, insufficient sleep is significantly associated with diabetes, with obesity, with cardiac difficulties, and a host of other physical and medical challenges related to that.
Super. That's a really comprehensive review. Thank you. So it's really every aspect of our physiology and our body's ability to sort of grow and cope with the world. Rachel, can you dig into a little more around mental health? What do we know about sleep and mental health outcomes for young people?
Yeah, so it's kind of like a chicken or the egg scenario. So we can't really determine what comes first. And the relationship is bidirectional. So you have kids and adolescents that already have mental health concerns, anxiety, depression, behavioral difficulties, ADHD. And we know that poor sleep makes those problems worse, like make the symptoms worse. And we also know that a lot of those diagnoses come with poor sleep as well. So kids that are prone to worry have a lot of difficulty falling asleep and staying asleep. So now you have a kid that already has an anxiety disorder, and then they're having poor sleep, and then anxiety is getting worse. So it's kind of like this cycle that goes around. We also know that chronic sleep deprivation is associated with problems in adulthood with anxiety and depression. So little kids and elementary age kids that have chronic poor sleep, they go on to develop anxiety and depression disorders. We also know that there's some studies that have found that adolescents that have poor sleep are at higher risk for depression as well as suicidal ideation. So we have a lot of research that shows there is some link between poor sleep and mental health problems, whether it's the development of or just exacerbation of mental health difficulties.
So for a parent who has a child who may be struggling with depression or anxiety or attention problems, it may be that difficulties with sleep are exacerbating or even causing those challenges. It may also be that they had those challenges beforehand, and difficulties with sleep that are related to those conditions are actually worsening their functioning, worsening their symptoms. Thank you for explaining that. I really appreciate that. So Jillian, let's talk about behavior in particular. And Rachel talked about this dynamic relationship between emotional health challenges and sleep. Talk to us about behavior, particularly kids that you see with challenging or difficult behaviors, and how sleep is related.
Yeah, of course, it's no surprise. Research shows that difficulty managing sleep problems is really common in childhood, and that evidence suggests sleep problems negatively affect children and can contribute to irritability, difficult temperament, daytime sleepiness, so difficulty staying awake during the school day, unintentional injuries, which I think Valerie also mentioned, poor performance on academics, future anxiety in adulthood. Sleep problems can contribute to major behavioral challenges like aggression, tantrum, impulsivity, and self-injury. So sometimes when we are called in to, address behavioral challenges in a classroom for typically developing or for individuals with autism, one of the major things that we check with them is, how do they sleep at home? That's why sometimes schools call us in and they want us to just address the problems at school, but we have to also talk to the family, because that sleep trouble that they're having at night could actually directly be related to their behavioral problems at school. And it goes without saying, like, once we address those sleep problems, I'm not saying behavioral challenges just completely disappear, but they often start to show improvement. You might still need to address some things at school, but it's directly related to how they're sleeping.
And I'm guessing what you're describing is a way of thinking that parents and caregivers can use too. If they're noticing a change in their kids' behavior and their kids' functioning and what's happening at school, one of the first questions a parent might ask is, gee, how is she sleeping? Or has anything changed what's happening at night that might be part of understanding what's going on here?
Right. It definitely could help.
Yeah, thank you. So, Catherine, I'd love for you to educate us a little bit more about the biology of sleep, a little bit about, sort of what makes sleep different in children and adolescents than in adults. What are some of the things that are the same? What are some of the internal factors, sort of individual differences in each of us, how each of us sleeps, because none of us sleeps exactly the same. And then some external factors that may impinge upon kids' lives and on their abilities to get adequate sleep.
Yeah, so sleep in general, we tend to recommend ranges for kids. So there's generally recommended ranges for different ages that are appropriate for kids. I always like to tell families, though, like, the right amount of sleep for your child is what makes them feel good. So a range is just a range, and it's just a recommendation. Matt, as you mentioned, everybody is individually different, and there's different factors that contribute to that. And so making sure that you're feeling good during the day, your child's feeling good, that's what kind of tells us, hey, they're doing well and they're sleeping well. One of the big factors that we know of is everybody has an internal body clock that we call the circadian rhythm. And we refer to that as what helps you tell when it's time to be awake and when it's time to be asleep. And that is really regulated by a lot of those external cues you were talking about in our environment. The most predominant one is light and dark. Really tells us, again, when to be awake and when to be asleep. So when the sun comes up in the morning, we tend to wake up, and when it starts to get dark, we start to feel sleepy and we want to be able to go to sleep. But there are different kinds of circadian preferences. And so people tend to often fall into one of two categories, either more of a morningness preference. We sometimes call those people early birds or morning larks, or more of an eveningness preference. So for those night owls. And that can really change across the lifespan as well, what that preference is and what that looks like for different kids. And so toddlers often tend to have more of that morningness preference, and they like to wake up early. And regardless of when you put them to bed, they are still going to pop up and be ready to go in the morning. And so when you want to sleep in on the weekend, they don't want to sleep in because they're still ready to go. And that's really because they're biologically designed and ready to be awake and ready to be alert at that time in the morning. Whereas on the other end of it, teenagers tend to most often display more of an eveningness preference. And so they like to stay up later, they like to sleep in later. And if they try and go to bed earlier, it's really physiologically hard for them to be able to settle down because they don't often feel tired at that time. The time that they feel most tired is more delayed. And that can cause difficulty when you're trying to wake them up in the morning, because that might be really the middle of when they are feeling most tired and they really are wanting to continue to sleep, but they need to get up for school. And so when kids start to, or adults even, misalign when they're sleeping with that circadian rhythm, we often see a lot of those problems develop, of kids either waking up too early when you want them to sleep in, or not being able to wake up because their body is really telling them, no, this is still time for me to be sleeping. And they feel really that strong urge and pressure to sleep.
Yeah, super. That's really helpful. And so these differences that happen individually, so from person to person, and then happen developmentally according to different stages of childhood, adolescence, then adulthood, and even across adulthood, it changes. There are some external factors as well. Valerie, talk to us about school, and the way that the timing of school can impact children's sleep.
So I'm hoping you want me to talk for the rest of the time that we're on here, because this is really my soapbox. So very often in the United States, middle and high schools start excessively early, particularly in relation to what Catherine was just describing in terms of adolescent circadian rhythm. And we do, with the onset of puberty, see that shift later. And as she mentioned, it can be physiologically impossible for a teenager to fall asleep early enough to get up for a very early school. And so the American Academy of Pediatrics and the Centers for Disease Control recommend that no middle or high school start any earlier than 8:30 a.m. Yet the vast majority of schools do in the United States. And so it really leads to chronic sleep deprivation in adolescents who are already at a developmental stage where they are at peak risk for depression, anxiety, suicidal ideation, accidents, motor vehicle accidents. They also have a lot of academic pressure and are needing to perform well academically while getting really insufficient sleep at night. And so it does create this, what Mary Carskadden, who is a longstanding researcher in adolescent sleep, calls the perfect storm. So very often parents are overseeing bedtimes less regularly in teenagers than they did when children were younger. There's academic pressure to stay up later and social pressure. And at the same time, the need to get up very, very early to go to school. And so I like to use my own children as an example here that although I have been advocating for this for many, many years, the high school that my children attended started at 7 o'clock in the morning. And as they got older, I watched them each academic year, they were falling asleep later and later. And the research bears this out, but I watched it in my own home. And then they were needing to wake up at 5:30 in the morning to go to school. And that is biologically unkind to adolescents. And not only are they getting shortened sleep, but because of this delay in the circadian rhythm, they're not fully alert at 7 in the morning. So it's very similar to asking an adult to get up at 3:30 in the morning and hit the ground running at work. And, oh, by the way, why don't you do some calculus now? And so it is a way I think that we are not following the science in our country in terms of promoting optimal development and optimal physical and mental health, as well as academic performance for our teenagers.
Yeah, I mean, I really appreciate the intentional drift here into advocacy for a moment. If just give us one more minute, we won't take the whole time, but why is it like this? And what is the resistance of school districts to listening to experts like you, to the AAP, and to the parents in their districts to sending early elementary school age kids who are up and alert at 7 a.m. to school at 7? And
Yeah, I think you really do want me to talk the whole time. So I'll be kind to my co-presenters, but it really pulls at me. There are some historical reasons that, in particular, a long time ago, before we used school buses, most schools started at 8 o'clock or 8:30, and schools started to drift earlier as buses started being used in public school districts. And to save money, they typically wanted to have one set of buses and one set of bus drivers who ran multiple routes. And originally the idea was, let's send the oldest kids first because they're more independent in getting themselves up and out to the bus stop. They'll get home the earliest. They can take care of younger siblings. And this will be a good way, to sort of rotate when these bus stops happen. When we look at community surveys, it is actually a very small percentage of high school students who are babysitting younger siblings. So that is one concern that people bring up. Another concern that's brought up very often is what's going to happen to after school jobs. And in schools that have moved later, what they have found is most of the after school jobs for high school students cater to other high school students. So a fast food restaurant. So I'm thinking of, I'm trying not to use a specific name, but there's a fast food restaurant just down the street from the high school where my children attended. That's where everybody goes after school. That's where the high school students go to work. So if you shift later and they're now getting out of school an hour later, that's when they need workers. And so it really does not tend to have as big of an impact on after school employment as people imagine. Another big one is sports. And so people will say, well, how are they going to practice? What time are their games going to be? They won't be able to do as well in sports. And again, in communities where the change has been made, school sports participation, other extracurricular participation isn't changed. So what we have found is most of the arguments that people bring up have really not borne out to be the case in communities that have made the change. And then sometimes there is a general resistance to changing things that we're accustomed to. And so we will also hear they're not special snowflakes, their bosses aren't going to let them go to work late, and they need to learn to wake up early now and do things early now. And, the challenge there is it's very similar to saying a 2-year-old shouldn't take a nap so that they'll be ready for elementary school.
Right.
Because a 2-year-old physiologically needs a nap, even though a first grader doesn't usually. And so teenagers have a different biology and circadian rhythm than adults. And also most adults don't work 7 a.m. to 2 p.m. That's not a typical work. Some do, but that's not a typical work schedule. So I think that it is really incumbent upon professionals, but also parents, to really be advocating with school boards and helping them understand the science behind this, but also the success that communities have had in making the change. California now has a law, and very soon all middle and high schools that aren't in rural areas will need to start at 8:30 or later. I think the middle schools are 8, but we have a responsibility, I think, that when we know better, we do better, and we know the science and we know what would promote better health for our kids. And I think we need to be advocating for that. Start School Later is a nonprofit organization that I always recommend people look at. They've got great resources and a lot of help for people wanting to advocate.
Fantastic. That was an awesome set of information and actionable too. So thank you so much for sharing that perspective. So Rachel, this is the part in every conversation about kids' mental health these days, we get to the part where we talk about social media and phones. So talk to us about social media and phones and the impact on sleep.
Yes, of course. Yeah, there's always a time where we talk about social media and phones because they are so pervasive to all things kids, teens, and mental health. So we know that social media and phone use is definitely associated with sleep difficulties. So we know that kids and adolescents who are on their phones before they go to sleep have difficulty falling asleep and staying asleep. And there's a few reasons for that, and I'll get into that in a moment. But there's a lot of research that shows that even among 10 to 14-year-olds, 17% reported that they woke up because some sort of notification on their phone, or like phone call, text message, social media. So throughout the middle of the night, they're being woken up with the phone in their room. And then 16% said that they had difficulties falling asleep because they were on their phone before going to bed. We also see that there's been an increase, someone had talked about this too, but there's an increase in adolescents getting less than 8 hours of sleep a night. And this correlates with the increase in TikTok, social media use. So you can kind of infer here there might be a relationship there. And when we think about why phone use before sleep can impact our ability to fall asleep and stay asleep, Catherine talked about circadian rhythms. So we know the blue lights that's emitted from screens affect circadian rhythms and suppression of melatonin, which we need to be sleepy. So if we're not having the melatonin being suppressed, we're not feeling sleepy, it's going to be harder to fall asleep. And I know, like, thinking about as an adult, this happens to me too. I'm guilty of it. Sometimes I'm scrolling on my phone or I'm answering emails, and then I realize I go to sleep way later than I had intended to do. And then even when I do try to go to sleep, I can't fall asleep quickly because my brain is, one, it's still awake because I was just working, and then I tried to go from work to sleep and from the blue light emitted from the screens. So it's really important to have a transition period of putting devices away and then having this transition to going to sleep instead of just turning off device and then trying to fall right asleep.
That was a bolus of great information that I want to sort of pick up on some of it, because this is the point in the conversation where I want to sort of shift from, I think you all have articulated the challenges really clearly, and we want to get to things that we can do. And there are a lot. And so Valerie and Rachel have each highlighted two things. One, we can advocate locally for our schools to start at a time that's developmentally sound and based in science. Two, Rachel, we can think about, and we had a webinar on this topic a couple of months ago, we can start to think about what parents can specifically do around developmentally appropriate access and then end of access to technology, particularly to phones in the evenings, because of the impact they have on sleep. So let's talk about other things we can do as well. Let's try to get practical here. Jillian, why don't we start with you? When you work with parents whose kids are struggling with sleep, what's the first step? Where do you start with them? What's the key message you want to communicate first to families?
The very first step is to determine the goals. And I know that might sound so obvious, like, obviously I want my kid to go to sleep and get enough sleep, but really you got to be specific about what are the problems, what are the challenges, and then what do we need to fix? You really have to identify where the challenges are before you can find a way to solve it. So I suggest keeping data, or what's nice and easy, just keeping a sleep diary for the nighttime routine and what overnight looks like for your child. And it helps you identify the areas that really need to be changed. Another important thing for families to remember is that sleep goals are going to be really personal. So for some families, it might be really important that their kids go to bed early, and they recognize that that might make them wake up earlier. For some families that I've worked with, they're like, you know what, I don't mind. I need my kids to sleep a little bit later. Okay, then we're going to focus on a later bedtime. You can't have a 7 p.m. bedtime and also like a 9 a.m. wake up time. Probably not going to be possible. So just keeping in mind that, like, everything is really personalized to what's important for your family. And goals could be anything. They could be reducing night wakings. They could be reducing dependencies, like the parent having to stay in the room until their child falls asleep. That's something that we work on, really common. But the biggest thing that I work on with families that they might not even realize is going to affect those goals is the nighttime routine. A couple of people have touched on it already, like that time where you're separating your phone from your bedtime, that time where you are like preparing yourself that it is time to sleep. And adults should do this as well, but it's especially important. You could start teaching this to kids, at babies as young as 10 to 12 months old, or to just prepare for the nighttime and to teach them to self-soothe, put themselves to sleep without their parents in the room.
Right. Well, that's a perfect transition to something I wanted to ask Catherine about, which is, Catherine, help us think about, and maybe you can frame this developmentally in ways that Jillian started to, about, the sleep is a biological transition, right? It's a transition from one state to another state.
Yep.
And sometimes as clinicians, we talk about sleep hygiene. But these are the behaviors that create sort of clean sleep. So talk to us about sleep hygiene. What are the components of good sleep hygiene, and across different stages of development? Maybe toddlers and preschoolers, maybe elementary school age kids, and then middle school into high school. What does good sleep hygiene look like across development?
Yeah. There's lots of things that go into good sleep hygiene. As Jillian was mentioning, you can really start this early on, and very early on is the best way to start it. But if you haven't, you're not over, nothing's wrong. You can always start it at any point and kind of develop those good habits. So that's the good news. That wind down routine is really important. So generally we recommend about an hour before bed is a good time to start that transition. And that's including environmental cues and then also what you're doing. So turning down the lights, turning off overhead lights, switching to low lighting, turning on lamps, dim lights, things like that, again, is kind of that cue to that circadian rhythm that it's time to start winding down. An hour before bed is a great time to turn off those electronics. I really like having, bedtime for electronics as well. So put the screens to bed, as well as we're preparing the kids to go to bed. And really modeling that for your kids can be really helpful, as Jillian was mentioning, like having the whole family involved. So it's not, okay, mom or dad or somebody else is still on their phone, but I have to put mine away. So having a central location for them can be really helpful. And then transitioning to some other really relaxing kind of calming activities. So these could be things like reading, drawing, stretching or yoga, playing quiet games. But I also always like to encourage families to include other kind of sensory things that they know is helpful for their kids to calm down. And that's really helpful for especially young kids. So turning on quiet music, maybe doing some things like massage or wrapping them in a warm blanket. Or for older, kids can do those things more independently, but having those same things transition with them so that they start to kind of say, okay, I'm slowing down my body. I'm starting to prepare for sleep. I'm quieting my brain. The environment around me is also quieting and getting ready. Doing specific relaxation strategies is always helpful too. So things like deep breathing or other muscle relaxation or some other guided meditation. There's a lot of really great apps out there now too that have sleep stories and things that kind of prepare and help with that transition. That can be really useful. And then the type of routine that you have is also really important. And so that's something to really think about. Consistency is key here. Consistency is really important for sleep. And it's not just timing of consistency, but the things that you're doing, the environment that's around you, the order and the way that you go about doing those things. So thinking about those is really important. The way kids fall asleep is really what they need to stay consistent throughout the night in order to keep them asleep. So that's another key thing. So oftentimes it's think about like, okay, what do I want them to be able to do in the middle of the night if they wake up? How do I want them to be able to fall asleep? And we want that to be the same thing at the start of the night. So if you want them to be able to fall back asleep on their own in the middle of the night, we really want to set them up for success at the start of the night doing that. And having that kind of quiet wind down routine that helps them prepare for bed, transition, kind of go in that direction, but keeping it really simple, like 3 to 5 things most as part of a routine is what's beneficial for most kids.
So what might be 3 things, Catherine?
Yeah, so something might be great of, you transition, maybe it's a bedtime snack in the kitchen, and then you go brush your teeth in the bathroom, and then you move to the bedroom and you put on pajamas and you read a book and you get in bed. So really simple, but it's going in one direction. You're not kind of up and down and back and forth across the house. It's quiet, it's getting them prepared, and doing those things in the same order every night. So it can be just that simple, nothing big, but just really helpful for kids to prepare for sleep.
Super. The consistency is so important. And also, as any of us who are parents know, it's also the hardest thing. So it's really hard to do the same thing each night, but it really pays off. So Rachel, so many of my patients who struggle with sleep also struggle with anxiety, and these things seem to feed off of each other. What can parents do who have a child who they notice get ramped up with anxiety at night? That's the time of day where things that didn't go the way they hoped during the day are starting to cycle through their heads, or they're looking forward to the next day and the homework that they didn't finish, or the test that they have, or the classmate that they're nervous to see the next day. What can parents do when there's that those things are coexisting for kids at night?
Yeah. So Catherine started talking about starting with the sleep routine is one really nice way to help when kids and adolescents know like this is what's expected and we have that time to relax, use some of the techniques she talks about like deep breathing and progressive muscle relaxation, visualization, guided imagery, using apps to help kids so that also when they wake up in the middle of the night, they know what to do. So having like a coping plan. So if you get scared in the middle of the night or you wake up and you have difficulty falling asleep, what can you do to help yourself stay calm and go back to sleep? So like coping statements, like telling yourself, I am brave, I can do this, I am safe, I'm home, my parents are down the hall, or things that help them feel more relaxed and able to fall back asleep. It's important also to talk to them about their fears and their worries, but not before bed. So something that could be really helpful is to have a worry time earlier in the day or maybe before dinner, so that they have time to get all their worries out and talk about these things that are on their mind so that they're not waiting until when you tuck them in at bed to start talking about all the things that they're worried about. Maybe having like a worry box so they can write it down and put it in the worry box. And then you can tell them if they start bringing it up close to bedtime, remember that's for worry time, like we'll think about that or jot it down and put it in your worry box and talk about it tomorrow. And it's really important for parents too to make sure that they're validating these worries and fears, but not reassuring and also reinforcing the anxiety. So Jillian talked about this a lot too, about like ways to use like gradual exposure for like if children need help falling asleep. It's like you can start with sitting on the bed, then sitting across the room, then at the door, then outside the door. So we really want to focus on like this brave behavior and reinforcing with praise. And you can use other reinforcers like rewards and sticker charts to help improve and increase this brave behavior. And then something that could be important is if the anxiety and worries are really interfering with the ability to sleep and stay asleep, then therapy could be a good option to start working on tools to help manage that anxiety and worry.
So I'm gonna sort of double click here for Rachel and Jillian both, because there are so many questions in the chat that are versions of this, which is, okay, so let's imagine a child who's 8 years old and they still are requiring their parent to be in their room, sitting on their bed, lying next to them in bed every night to fall asleep. Can you guys just walk through in the next couple of minutes, how could that parent think about beginning the process of helping that child to fall asleep alone?
Yeah, I think we've mentioned it before, but like it's never too late to start. But really where you have to start is I always recommend a sleep diary so you could see what's going on.
Hold on,
But
can I stop
really
you
the
there?
place, yeah.
Sorry, so tell parents, what is in a sleep
Okay.
diary? What's in a sleep log?
So in a sleep diary, you want to write, and you could just write a narrative. You don't have to get complicated with a whole data sheet or anything like that. You could just write a narrative. What are you doing when you're going to sleep or when your child is going to sleep? Like, what does it look like? What does your nighttime routine consist of now? Is there one? What are you doing for your child? So are you laying in their bed? Are you waiting till they fall asleep? Are you leaving the room? Are you staying the whole time? Are you sitting next to, like, what exactly does it look like? That's what you want in a sleep journal. And then once you have that information, you could see, okay, what am I doing? Because I think Rachel mentioned this or Catherine mentioned this, but like however your child falls asleep, when they inevitably wake up throughout the night, because everybody does, it's just the way sleep cycles work, they're going to be looking for that again to help them fall back asleep. So if you have someone that their parent is there helping them fall asleep, that's why they're looking and they're unable to fall back asleep in the middle of the night because they're looking for their parent again. So it's never too late to start. And I would start with the nighttime routine, just altering the nighttime routine. And then you could start moving yourself further and further away. There's a couple strategies that you can use, but that definitely is a good one to start with.
Rachel, how do you convince kids to go along with this?
You have to use some sort of reinforcement. So you need to get some motivation and buy-in. So whether it's like setting up a sticker chart if it's a younger kid or an older kid, some sort of like point system or collecting coins so that if they're able to stay in their bed, and you might start really small, like it might be for 30 minutes or an hour or half the night or the whole night, then they earn something the next morning, or they're working towards earning like a bigger prize or a bigger reward.
So you might start with they're able to earn a reward that they get right away. They get the next morning if they've been brave in a way that night that you agree on. So rather than you sitting on their bed as a parent, maybe you're sitting in a chair in the doorway. And if they're able to be brave and fall asleep like that, the next morning they get a token that's going to go towards extra game time that weekend when they have screen time. And they do that again, they do that again, they do it until it gets easy. And then you sort of up the challenge. And now the parent's in the hallway rather than in the doorway, and continue to reinforce it like that. Am I getting the right idea?
Exactly. That was beautiful.
Definitely. And you could start even smaller than that if you need to. You could start like, I'm right next to your bed now, and fade it like that.
Super, thanks. So Valerie, you've talked about your own teenagers' experiences with high school and sleep. I'm there myself right now. So how do parents, particularly of teenagers, know that their kids' issues with sleep are really of clinical importance? Like really, where they need some help, they need some outside consultation, they need some guidance because their kids are really suffering.
I think, sometimes it can be difficult as the parent of a teenager to know, is it their sleep that they need help with? Is it their mood that they need help with? Because many teenagers go to sleep after their parents. So their parent may be less aware of just how significantly their sleep is being truncated. But I think that for parents of adolescents, anytime you notice a significant change in their mood or behavior, that's a time that you want to increase your communication with them, which is, again, delicate and not always easy. But you want to be exploring with your teen what might be behind some of this. So if you notice that they seem irritable, if they're spending excessive time in their room beyond what most teenagers already do, if they're late to school a lot, if they're having changes in their grades, if they seem like they're worrying, they appear anxious to you, if they're withdrawing from activities that they previously have enjoyed, or changing their friend group, or being less social, these are all indicators that a teenager is likely suffering. And it's not always easy to know, is it depression? Is it a sleep problem? Is it both? But those signs are an indicator that it would be important to seek some additional assistance, and then that professional can help kind of identify what's driving some of that. And I mean, you gave the statistics at the beginning, Matt. The majority of teenagers are not getting enough sleep. So probably sleep is in some way related, even if it isn't the full explanation of what the challenges are.
Right. I'm guessing you have this experience in your clinic, Valerie, but if I see a teenager who is struggling with depressive symptoms, and when I start to get to know them, I find out that they're sleeping typically 4 or 5 hours a night, I kind of stop right there and say, the first thing we're going to do is work on that. Do you take a similar approach?
Oh, absolutely. And I think too, yes, if they're getting insufficient sleep, we have to improve that and then see what we're left with. It's similar to what Jillian was talking about with younger children and behavior. It's the same approach to mood or anxiety. And it also, it's summer right now. And so many teenagers have the opportunity to get sufficient sleep in the summer, that they lose that opportunity when the school year starts. And I've had parents tell me they didn't realize how significantly sleep was impacting their teen until it came time for summer or a holiday break, and they were sleeping more and seemed like a different person. And so I think too, if parents are noticing that, that's a really important time to be trying to get some help. We know
for a long time that teenagers get healthier in the summer. And
yes.
The fact that they're sleeping more is really a big part of that. Catherine, what are some of the medical factors, the physiological factors that can influence sleep in young people as well?
Yeah, so sleep problems or sleep disorders can be either medical and more physiological in nature, or more behavioral. And we've talked, about several of those behavioral things. Mental health is definitely one big contributing factor there. Some of the other more physiological things that you want to look out for are snoring, or any pauses in breathing, or gasping at night. Those are things we typically don't see in kids. And so if you're seeing that in your child more consistently, not just when they're ill or have a cold or something like that, that's something to look into and have them get checked out and talk with a physician about, to see what might be going on there. Other things can be just really restless sleep, and that can be a big disruptor to kids' quality of sleep and the way that they're feeling during the day. So I often like to ask, families, like, do the sheets end up off the bed, or are they in a big ball at the bottom of the bed? So looking for things like that can be a good indicator when you're not in the room all night with your child, and so maybe you don't know. For those kids that sleep with you, you definitely do know when they're restless kicking you or things like that. So those are things that we want to look into as well, for other different causes of sleep disorders specifically. And then there are some other medical conditions and things that can really impact sleep that we always want to think about as well. So chronic pain is a big one. If we're uncomfortable for any part of our body, that can be really disruptive to either falling asleep or staying asleep. Things like eczema can also be really disruptive to sleep for kids that are really itchy at night, and have that urge to itch, and can really impact them and cause difficulty. Things like reflux can also cause some problems there. So there are a lot of those other medical signs that we want to rule out when we are having trouble. But if we've ruled those things out and kids are still having trouble falling asleep, waking up and having difficulty falling back asleep, then we look more at kind of some of those behavioral strategies of how can we teach them skills, how are they falling asleep, how can we promote that with them.
Super, thanks. I'm going to pose one more question, and Catherine, that was really comprehensive. Thank you. And this, Rachel and Jillian, I'll ask you each to think about responding to this. And then we're going to get to some of the audience questions. So just talk a bit about what you find to be most helpful for kids who have autism and for kids who have anxiety or depression, who are struggling with sleep. What are the ways that families can bring those issues to clinical attention, and what do you see mental health professionals doing that really tends to help in those situations?
For a client that has autism, I think sometimes parents think like maybe sleep is not the most pressing need, when actually it is a huge pressing need. So sometimes there might be like that like kind of instinct to medicate, which is completely fine. That's a decision between a family and the doctors. But just remember, medication alone doesn't teach the skill of sleeping. So maybe also reach out to a BCBA who can assist behaviorally with that as well, especially if you're noticing a lot of behavior challenges during the day. That could be a really good step to take to address that sleeping need.
And then when you think about like with anxiety and depression, a huge piece is, if you're going to therapy, is psychoeducation. So teaching, especially for adolescents, the importance of sleep, and teaching about how to fall asleep, these coping skills, what to do when they wake up in the middle of the night, creating these plans, teaching those good sleep hygiene techniques, and why we care about it, that can really help promote like that motivation to actually want to work on sleep, because it can be really challenging. These behavioral techniques take a lot of practice, and that consistency is really important.
Fantastic, thank you. So I want to get to some of these questions because there's some terrific questions, and I apologize in advance because we're only going to get to a fraction of them. But let's start with this one because it's summer. What's a strategy, and this could be for any age kid, for families getting kids sort of back on track with sleep? So it may be from a vacation back into regular life, it may be from summer back into fall, coming out of winter break back into the start of school. What's a way to reset clocks to be more sort of adaptive and functional for kids when things have sort of gotten out of whack? Anybody?
I can jump in there. I typically like to recommend giving yourself time to do it, not waiting until that weekend before school, because it's going to be really challenging. So slowly adjusting times about a week before can be really helpful, and moving them earlier, 10, 15 minutes every night. You move bedtime earlier, you move wake time earlier, and then the body naturally kind of adjusts. That along with kind of that light exposure, making sure you're dimming lights in the evening, you're getting them up in the morning, they're getting bright light, can really help be kind of a nice transition. So it's not an abrupt, it's not difficult to get them back on track for school. If you're able to keep in schedules fairly similar to school for the summer is also a good way to do it. So, within an hour or two of a normal school schedule helps that transition just go a lot easier and a lot smoother.
Perfect. Thanks, Catherine. This next one is a sort of an adolescent question. So maybe this is for Valerie or others can jump in as well. So what a teenager who isn't lucky enough to live in California and has school starting at 7 and so is up at 5:30 or 5:45, and Saturday comes and they want to sleep till noon. Should we let them, or is it important to keep them on close to the same schedule all week long? Because we know as adults we're supposed to sort of keep the same schedule. Like we sort of do best and our sleep is best. If we wake up at 7 for work, we should wake up at 7 every day, or 6 whenever we wake up. What about teenagers?
So the purist would say you should keep your same schedule 7 days a week. But we have to be realistic and not lose all credibility and tell teens, no, get up at 5:30 on Saturday morning. But you probably should split it somewhere in the middle. So what happens if they sleep until noon or 1 is something that we call social jet lag, which is like flying across multiple time zones and back in one weekend. And then Sunday night, they cannot go to sleep. And then Monday morning is really difficult. And it just starts the week off really in a challenging way. So what I typically recommend for teenagers is that they really don't sleep more than a couple of hours later than they do during the school week, and that they try to maintain a bedtime that's relatively consistent, maybe an hour later on the weekends compared to what they do during the week. It is hard because there are social pressures, and it is their natural circadian tendency to go to sleep later and wake up later in the morning. So similar to what Catherine was describing about making sure that they get sun exposure in the morning, that they're up and getting exposed to light to help reset that circadian rhythm, and also to help them feel a little bit more alert. And I typically recommend for teenagers that they have something engaging or interesting to do in the morning. So if they play a sport, that they can get up and play sports. If there's a friend that gets out of bed before 12, they can go do something with them. Because if all you're asking them to do is wake up and roll over and look at TikTok, that's not going to be beneficial in terms of helping them be on a more regular schedule.
Absolutely. Absolutely. So let's turn to a question about younger kids. So for most of the world, like truly like 80% of the world, co-sleeping between babies and toddlers and parents is the norm. We're one of the only cultures here in the United States or around the world, and certainly there's lots of cultures within the United States, but oftentimes the dominant medical culture and behavioral health culture is insisting upon babies and toddlers sleeping apart from their parents. What's some perspective on that? And how do you help families think about that who may really value co-sleeping culturally, and also families who would rather not co-sleep, but their kids are really pushing to co-sleep? Rachel, Jillian, Catherine, any thoughts?
I can jump in. I think it's important for the family to think what makes sense and what matters to them. So if parents are having difficulty because of co-sleeping, like they're not sleeping because the kids are in their bed or waking them up, then that would be a discussion of then if you want them to move out of the bed, how would you work on that? But if a family thinks that's working and it's not impacting them or the kids sleep, then that's what works for the family. So I'm always putting it back on the family to see what's their goals, what works for them, and also down the line too. So is this something you want to do forever? Is this something you want to do for the next few years, thinking ahead to then, well, how will you then transition them out of your bed if that's something you do want at some point? So thinking about those like gradual approaches that we've been talking about, like starting really small and then working up from there.
The one piece I would add to that is just in really young infants, the American Academy of Pediatrics recommends room sharing, but not bed sharing to ensure safe sleep. So that's the one, I mean, just to add on to what Rachel's saying, that's the one little caveat I give beyond family preference and values.
Jillian or Catherine, anything you guys would like to add?
Yeah, I would agree with that. I similarly always want to work with families as far as what their goal is. And as Valerie mentioned, I also add that caveat for the first year that we really recommend just room sharing for the infant's safety and for everybody's safety. But if families like to sleep together, that can be really successful for a lot of families. And it's okay to do that. There's no contraindication for sleep that they shouldn't do that. It's really when it starts to disrupt either the child's sleep or the parent's sleep that it becomes more problematic.
Yeah. I was just going to add that is why sleep goals are so personal to families. It's like you might have other sleep challenges and other sleep goals, but you don't have to work on stopping co-sleeping if that piece of it is working for you.
Super, thanks. So there are a lot of questions in the Q&A about medicine, and so I'd like to weigh in on that, and then would love to hear from you all as well. And I'll preface it by saying that decisions about medication are individual decisions between a family and a provider. And so these aren't specific medical recommendations at all. It's really common for adults and kids to be prescribed medications for sleep these days. And I think it's really important to point out that the evidence for medication successfully treating sleep problems in children is very limited. There's not much evidence. There are not a lot of high quality studies that convincingly show that medications are helpful for sleep for children and adolescents. And so we've spent 95% of this hour talking about behavioral and emotional strategies and routines and family-based practices because those have lots of evidence for helping with sleep. In fact, sort of overwhelmingly more evidence than medication has. And yet medications are prescribed a lot. And so those medications are usually prescribed when a family is feeling really desperate and really challenged and when a provider wants to be helpful. So not to malign that practice, but just keeping in mind that the evidence is really slim. And that if you as a parent or grandparent or caregiver are caring for a kid who's struggling with sleep, your healthcare provider should start with behavioral interventions. And if they don't, you should find another healthcare provider because that's what our evidence shows. There are really small and limited number of studies around melatonin in kids. Melatonin is used a lot because it's inexpensive and it doesn't require a prescription, and it's produced in all over the place. You can walk into any CVS or Walgreens in the country and get melatonin, and so it feels like an easy recommendation. I think parents should just know that the evidence around melatonin is mostly for shift workers and jet lag, and very little evidence for children with sleep problems. There is some evidence for melatonin for children on the autism spectrum and it being helpful with regulating their sleep architecture and sleep patterns. There's even less evidence for kids with ADHD and melatonin. So I think this is not to say that kids shouldn't be prescribed and shouldn't take it, but the conversation should be really realistic and based on science with providers, and parents and caregivers' expectations about how much it's going to help should be realistic. Is there anything that you guys would add about melatonin or medications in general?
I'm not a prescriber, but the one thing I would like to say about melatonin that's a real challenge in the United States is that it is not an FDA regulated drug. It is a nutritional supplement. And so in studies looking at melatonin, when comparing different brands, different dosage, bottle to bottle of the same brand, there is no consistency in that what is on the label is the amount of melatonin actually present in the supplement. And so that's a real challenge. And then there have been several that actually have other supplements included that are not listed on the label. And so a challenge in the US is because it isn't regulated, a parent purchasing what they think is 3 milligrams of melatonin might be 10, it might be 0.5, it might have other valerian root in it, that it is just a challenge to know for certain what it is that you're getting and giving to your child. I don't know if anyone else on the panel was at the International Sleep Meeting a few weeks ago, but we spent a lot of time talking about melatonin in a session and some of these challenges related to it. And Judy Owens, who's a developmental and behavioral pediatrician and a sleep expert, one of her concerns about using melatonin is the message that it could inadvertently send to a child that if you're having trouble, take a pill. Instead of learning the skills that can be used to self-regulate in that way.
Right. I think those are great points.
I was just going to jump in there too, Matt, and add on what Valerie added at the end is sleep is a physiological process, but it also is a learned behavior. And we often don't think about it that way. And that's really why a lot of these behavioral strategies work, is because we are teaching a skill. And Jillian mentioned it as a skill earlier. And so we don't want to just treat it with a medication or a pill when that's not the root cause. And so we always want to figure out really what's going on. We mentioned there are some medical reasons for sleep disruptions, and those can be, treated with medications. But when they're behavioral reasons, we want to teach the skill and provide those behavioral interventions to improve sleep.
Yeah, absolutely. And when kids are prescribed medications for sleep, those are off-label uses for medications. Those are medications that are not being used as the FDA has approved them. By contrast, kids who are struggling with sleep and also who have depression or anxiety or ADHD, treating those conditions with FDA-approved medications that have been demonstrated to be effective for those conditions in kids, oftentimes secondarily can really help with sleep. So I think these are just the kind of questions that I really encourage families to have with your pediatrician, with the psychiatrist if you're working with a psychiatrist. And I just want to mention, as we get close to wrapping up, that this webinar series is being sponsored by the Child Mind Institute and by Fort Health. I really encourage people to check out childmind.org as a great resource for information about all things child mental health, and to look at forthealth.com if you're a family in New York or New Jersey and you're looking for high quality evidence-based treatment for sleep disorders and other related conditions. We have a great clinical team that is available to treat families in the New York and New Jersey area. So I really appreciate everybody's consideration of this topic. There's obviously a lot of interest in it, and we were really lucky to have such a constellation of experts here tonight. So Valerie, Catherine, Rachel, Jillian, thank you so much for contributing your expertise.